Welcome to the module, A New Syndrome, Understanding the Impact of Cardiovascular Kidney Metabolic Syndrome, presented by Superior Health Quality Alliance. This module was developed for healthcare workers with an interest in examining the impact of cardiovascular kidney metabolic syndrome. The objective for this learning session is to achieve the following. Examine cardiovascular kidney metabolic syndrome, otherwise known as CKM syndrome, as a new disease. Describe screening, symptoms, diagnosis, and management of CKM syndrome. And finally, to examine how preventative care strategies decrease the risk of CKM syndrome. Cardiovascular kidney metabolic syndrome, or CKM syndrome, is a new diagnosis as of October 7, 2023. It is a multi-system disorder, including metabolic risks. Metabolic syndrome is an umbrella term. The criteria for metabolic syndrome indicates that if you have 3 out of 5 risk factors, you are diagnosed with metabolic syndrome. This criteria includes elevated fasting glucose, increased waist circumference, elevated blood pressure, high triglycerides, and low HDL cholesterol. Once diagnosed, patients are encouraged to make changes in their lifestyle, such as diet and exercise. We continue to have patients with chronic kidney disease and cardiovascular risks, and that's because they are all connected. Cardiovascular kidney metabolic syndrome is a complex disorder that involves the interplay of cardiovascular disease, kidney disease, obesity, and type 2 diabetes. These conditions are interconnected and often coexist, exacerbating each other and significantly increasing health risks. The American Heart Association's Presidential Advisory Statement highlights this interconnected nature of cardiovascular disease, kidney disease, obesity, and type 2 diabetes. CKM syndrome is defined as a condition where metabolic risk factors, chronic kidney disease, and cardiovascular disease interact, leading to significant health impacts. It's highly prevalent and it profoundly affects morbidity and mortality, especially among populations with adverse social drivers of health. Current scientific considerations of CKM syndrome include excess and dysfunctional adipose tissue or body fat, metabolic risk factors, chronic kidney disease, and cardiovascular disease. When we look at these risk factors in the context of chronic kidney metabolic syndrome, these are your risk factors. A high body mass index. This one is a critical indicator of obesity, which is a major risk factor for both metabolic syndrome and cardiovascular disease. Monitoring BMI helps in assessing the overall risk and managing weight-related health issues. The metabolic risk factors include conditions like hypertension, hypertriglyceridemia, type 2 diabetes, and metabolic syndrome. Chronic kidney disease is closely linked with metabolic syndrome. The kidneys play a vital role in filtering the waste out of our system, as well as excess fluids. So when kidney function is impaired, it just leads to a buildup of harmful substances in the body, exacerbating metabolic and cardiovascular issues. Cardiovascular disease encompasses a range of heart and blood vessel disorders, including coronary artery disease, heart failure, and hypertension. These conditions are often interrelated with metabolic syndrome as they share common risk factors such as obesity, high blood pressure, and diabetes. Early detection and management of these risk factors are crucial in preventing the progression of both metabolic and cardiovascular diseases. Regular screenings and comprehensive health evaluations can help identify at-risk individuals and implement appropriate interventions. This staging system helps in understanding the progression of CKM syndrome and highlights the importance of detection and intervention to prevent the development of severe cardiovascular and kidney diseases. Stage 0 is a healthy individual. They have no high risk factors. They have good blood pressure, blood sugar levels. They have low cholesterol. Their kidney function tests show that they're all within normal, and they have no excess body fat. So for them, they just need to continue wellness visits and make sure that they continue a healthy lifestyle, which means balanced diet, exercise, and so on. Stage 1, this group has excess body fat. Or it could be unhealthy distribution, such as abdominal obesity. They could also have impaired glucose tolerance or prediabetes. So for them, the focus is on weight management, so diet and exercising, and then just monitoring for signs of inflammation and early intervention so that we're preventing that progression to metabolic syndrome. Next is stage 2. These individuals do exhibit metabolic risk factors that, of course, increase their likelihood of developing CKM syndrome. So this is a group of people that have type 2 high diabetes, high blood pressure, high cholesterol, or kidney disease, and indicates a higher risk for worsening kidney and heart disease. The goal here for them at this stage is to address those risk factors to prevent the progression of cardiovascular disease and kidney failure. Stage 3, this includes people with early cardiovascular disease without symptoms and people with metabolic risk factors or kidney disease. So this stage includes individuals with subclinical cardiovascular disease and high predicted cardiovascular disease risk. There could also be subclinical atherosclerosis, endothelial dysfunction, and early signs of cardiovascular damage. So for this group, we want aggressive management of cardiovascular risk factors, including those lipid-lowering medications. We want to keep their blood pressure under control and make sure they make some lifestyle changes, and they should also have regular cardiovascular assessments and kidney function monitoring. So we want to intensify everything to prevent the progression. Stage 4, they have clinical cardiovascular disease as well as CKM syndrome. This group, they have diagnosed conditions such as coronary artery disease, heart failure, stroke, or peripheral artery disease. There's advanced atherosclerosis, significant cardiovascular damage, and impaired kidney function. And there's also 2 subgroups within stage 4, those that have kidney failure and those that do not. Also in this stage, people may have already had a heart attack or stroke, or may already have heart failure. They also may have additional cardiovascular conditions such as peripheral artery disease or atrial fibrillation. So by focusing on these comprehensive treatment and prevention strategies, healthcare providers can help manage CKM syndrome effectively, improve patient outcomes, and reduce the burden of this complex condition. So here is an overview of a few key recommendations. Lifestyle changes. So we know a healthy diet, a well-balanced diet, exercise, and weight management all make a big difference. when you're talking about metabolic syndrome and cardiovascular disease. There's also medical management, so taking medications for your diabetes, for your high cholesterol, and those statins to lower your lipids. Antihypertensive drugs, those are your ACE inhibitors, ARBs, beta blockers, and diuretics, because keeping blood pressure under control is hugely helpful, especially to protect kidney function. Then there's the anti-inflammatory treatments. So you've got your NSAIDs like ibuprofen and many others. And you want to address any chronic inflammation through medications, or lifestyle changes can really help reduce the risk of CKM syndrome progression. So that can mean quit smoking, eating better, and getting plenty of sleep. Third is regular monitoring and screening. So you should have regular blood testing to monitor glucose levels, your cholesterol levels, and kidney function. Blood pressure monitoring should also be done, or even keeping track of your own blood pressures, just for that timely and early intervention if things change. And as we mentioned earlier, kidney function tests. So this could include urine tests for albumin, which detects kidney damage. Fourth is patient education and support. So we need to educate patients. They need to understand what these these risk factors mean, and what they can do to either prevent or slow the progression through lifestyle changes, medication adherence, and other recommendations from their providers. Support groups can be hugely helpful. Sometimes people really feel alone in their health problems. So getting them in a support group with other people facing the same health challenges can really be meaningful for them. And then using a multidisciplinary approach, getting all the experts at the table can make a huge difference to ensure that they really have this comprehensive, robust plan of care. Lastly, addressing social drivers of health. So these in the past have tended to be overlooked, but can have profound impacts on health. Such things as affording health care, affording medications, having transportation, and then identifying those social drivers and then connecting them with community resources. It could be a food program or a nutrition program. It could be financial assistance. All of this to help them manage their condition more effectively. And health literacy as well, through education and clear communication, really help patients understand their condition and the steps they need to take. Key takeaways and resources. In summary, here are some key takeaways from today's presentation. Cardiovascular kidney metabolic syndrome is a multi-system disorder. If CKM syndrome risk factors are detected and managed early, people can prevent the progression to full-blown CKM syndrome. Prevention is by far the best medicine. So having those annual physicals or prevention care, it's a great way to receive screening and education on how to prevent future chronic conditions. And lastly, the stages of CKM syndrome help us understand its risk factors and its progression. We have created a list of tools and resources that might be helpful if you want to further explore the content we've covered in this video. If you have any questions about this video or others, please contact us at info@superiorhealthqa.org. Thank you.